Balami. Dr. Hawa Balami is a medical practitioner and the co-founder of Give Girls a Chance, a nonprofit that supports girls and young women to access and maximize the benefits of quality education through scholarships, capacity building, and advocacy. Dr. Hawa is an advocate for girl-child education, gender equality, and female empowerment. Dr. Balami completed medical school at Trinity College, Dublin, Ireland, and works as a physician in Abuja, Nigeria. She enjoys all aspects of medicine and wellness. She holds a master's degree in biomedical research from Morehouse School of Medicine, Atlanta, Georgia, USA, with a keen interest in public health and health policy. Dr. Hawa was born in Maiduguri, Borno State, and raised in the south of Nigeria and schooled in the north and southwest of the country. When life isn't too busy, she loves to travel, explore food culture, read books, and spend time with family and friends. You can reach her on Instagram or Twitter at Daniwa, that's DANEEWAH, or at GGAC_Nigeria. That's Give Girls a Chance. Dr. Balami, thanks so much for being with us today. I'm not sure if you have your video on, but I invite you to, I'll stop sharing here so that, let's see. Okay, perfect. So Dr. Balami, thanks for joining, being with us today. We have people calling in from New York, from Ilorin, Nigeria, and other parts of the country and the world. I think I can clearly say that what unites us is that we have all probably been to the doctor at least once in our lives. And if we do not learn what you teach us today, we might see doctors more times than we should in the future. So to start, why did you choose medicine as a profession? And I'm not sure, are you able to share your video?
No, just a second. I hope you can see my face. Yeah.
Okay. It's a bit blurry, but I think we can make do. Um, okay. Why did you choose medicine as a profession?
So for me, it's an interesting question because my parents used to say as a little girl, I always said I wanted to be a doctor and a pediatrician to be exact. I do not know why I was so exact as a kid. And I would love to play with a stethoscope all the time. My grandfather was a nurse, and he was the only medical professional around me, to be honest. I've just been lucky to be able to have my dreams come true. And I thank God I'm able to be a physician today. I love what I do and help people every day. It's such a privilege.
What does healthcare in Nigeria look like compared to the US and Ireland?
Oh, that's two different spectrums. I don't want to talk too much about it, but it's two opposite ends, low resources, high resources, advanced research in one end. Medicine is more advanced in developed countries than it is here in Nigeria. Technology, it's been used. Even just the electronic health system, only a few hospitals are adopting such things here in Nigeria. So it's two different spectrums. I would just end it there.
Okay. Now, health is one of the pillars of a professional Africa because we believe an employee cannot perform well if he or she is unhealthy. How important is what we're going to talk about today?
It's very important. You need to take good care of yourself to be able to function at work and thrive and be productive in everything that you do. So it's very, very important.
Okay. Wealth is another pillar. How do you define wealth?
I define wealth as having the valuable resources you need to control your life and secure your future economically, socially, and personally. So, economically, having the financial resources, the capital, investments, socially, your networks, your friendships, your relationships, the influence you have in your circles, personally, your health, the time, the skills, and your well being as a whole.
Okay. Now, this is a topic that is not often talked about or thought about, I think with HR or in companies, but when you defined or talked about wellness and health with me, you had said that emotional well-being is part of being healthy. How do relationships affect health?
Relationship can have an impact both two ways, positively or negatively, through emotional behavior and other biological pathways that it can affect, and that can cause an illness on the other end. Positively, if you have good relationships and good circles that build you up, it will reduce the stress, you have a better mental health, improves your physical health overall. And negatively, it would be if you have a bad circle relationships, it can lead you to risky behaviors. You can have more stress, mental strain, um, and that just trickles down to your physical well-being. Physical well-being, good relationships have been shown to decrease blood pressure. Strong have people have fewer chronic diseases, healthier behaviors. Encourages people to eat better, have more physical activity, exercise together, sleep well, go on social activities, and that keeps you more happy. And it goes on and on. So, negatively and positively, it can go both ways. So, we always encourage, of course, the positive part of it. So, people end up having better well being.
Thank you. A big part of succeeding at work is how you look, how you dress coming to work. And people know that Nigerians are very big on fashion. And I know you to be a fashionista yourself. What is your go-to style for going to work? And are you allowed to wear cultural outfits to work?
At the moment, it's scrubs, but I do wear Ankara scrubs, so the native fabric kind of scrubs. Switch up here and there, and I am allowed to wear the native fabrics to work. I tend to just do the kaftan dress style, so I can easily walk around, move around, and do what I need to do at work. But yes, I still dress fashionably, but in a smart way.
Okay. Thank you so much. So we're excited to hear you speak about health. Your video, I know it's a little blurry. Um, when you come closer, we can see you clearly, but otherwise it's blurring your video out. But I know that we'll be sharing a screen, so that might not be too much of a problem.
I don't even see what I look like. Let's see if I can see my face. Okay, I see what you mean. See, it's probably because I'm using this virtual background thing. Okay.
Yeah, when you move, it comes in and out.
It's not stay still.
But that's okay. I think you can, it's better now.
Okay, good. Okay. Hello, everyone. It's an honor to be here and talk to you about health and wellness. I really enjoy talking to people about their well-being and making sure they keep themselves healthy and how they can incorporate new lifestyle changes into their routine. It's the beginning of the year, so it's a perfect time to talk about where are you, where do you want to go to, and what do you see your future self being health-wise. So, what is health and what is wellness? Health, for the most part, we all know is being sound, mind, body, and everybody's more familiar with it in being sick or not sick, the presence or absence of a disease in the body. And wellness is more wholesome. What's your purpose? Do you enjoy what you live in? Lifestyles, a responsibility that you take every day that enhance your physical, your mental state, your spiritual health, financial health, and it's a long list. Wellness. I always talk to my patients about being well and not just being healthy. Being well because that's more wholesome, that keeps them more grounded, it allows them to enjoy their daily living. And wellness encompasses your work. We're all professionals here, so I'll start with the work. So, what do you do for a living? Are you satisfied with your career? Does it provide you with the challenge that you want every day? Does it provide you with the creative mind that helps you know or enjoy what you do? Intellectually, your mind, ability to think, to learn new things, skills. Are you open to new ideas, question information that comes to you daily and allows you to function properly? Your environment, I'm here in Nigeria, everyone is in different parts of the world. The impact of your environment is profound. Where you are in the world can gives you a different picture and a different reaction to what you do. And it also affects, also your relationships. It affects your intellect too, because generally, if you're in a more developed country, things are more advanced than you are in a non-developing country. So you find that everything that you do will be on a different level than the other. Financially, your aspect of wellness pertaining to finances, able to spend or not spend, planning finances, expenses. Are you living paycheck to paycheck? Do you have savings? Do you have investments? These things can cause people to worry a lot, and this can cause emotional turmoil. And socially, we talk about relationships. Are your relationships positives? Are they positive in that they build you up? Do you interact effectively with people? Do they drain you mentally or not? This is important for you to think about. Spiritually, do you believe in a higher being that gives you a certain purpose in life, joy, peace, and you follow that purpose and achieve your full potential? And last but not the least is the physical part. So are you well? Are you fit? And biologically, do you have any health problems or not? It's a paradigm. So most people that present to me would be on the left side of the scale. So they come, oh, I have a headache. I feel unwell. I don't know what's wrong with me. I just don't feel myself anymore. Most people would name different things that we call signs and symptoms. I have a cold, I'm sneezing, I'm coughing, I have a fever, etc. So when they come and then we dive into it, okay, we then diagnose you with something. If it's a chronic disease, it can cause a disability, which can affect, of course, your lifespan at the end of the day and can cause premature death. On the right side, that's where everyone wants to be, where you're well, and you are aware of where you are without an illness or with an illness. Do you have any risk factors at present? So in medicine, different diseases have risk factors. So some with age, I would take hypertension, for example. Being male already puts you at a risk. The age puts you at a risk. The older you get, you're more prone to that. Your environment, family history, those things you cannot change because they're just the risk factors you are already born with and you are aware of it. So now that you're aware of it, what are you doing with it? Are you enlightened enough or educated to know that, okay, I'm getting older myself. Okay, my mom has a hypertension, my dad has diabetes. Where am I? Am I closer to that or not? You to grow well, functioning at your highest level, which is the right side of this paradigm. So in health, the various changes has happened over time, moving from communicable diseases, which we call infectious diseases, where diseases are caused by pathogens, so viruses, fungi, bacteria. And today we find that most leading cause of diseases are chronic diseases. So things that develop over a long period of time and are caused by certain lifestyle changes, we call. Developing countries still are dealing with the former rather than the latter. So I would be comparing myself here in Nigeria and yourself there in the United States and the two differences that we see in these two countries. Leading cause of mortality in Nigeria, just have a look at all these. So the top 10, most of these things are what we call communicable diseases. So diseases that are caused by one pathogen or the other. Malaria is top on the list. Lower respiratory tract infections, so pneumonia, something like a pneumonia, diarrheal diseases. I joke about like malaria, for example, one. Any expert I meet here in Nigeria, I always ask you, are you taking any malaria prophylaxis? Because you are not born here, you do not live here, you're visiting, you are prone to malaria, and you can take medications that help you and prevent you from getting malaria. And that illness can eventually make you die, eventually, lead to death for you who have not been exposed to malaria, unlike people who live here and endemic to it their whole lives. Diarrheal disease is another one, very common. Within a week of coming in country, you would find that one person is complaining that I have diarrhea, I've eaten something and my tummy doesn't feels unwell. You picked one or two E. coli's, which bacterial viruses. Some people, we joke about things like, oh, you've been colonized, like E. coli colonized within a week or two once you land inside the country. Other things down the list, we have stroke, HIV/AIDS, and then maternal conditions. So on the right side of this, you see that 63% of the causes of death in Nigeria are communicable diseases, and then 27% come from non. And injuries will be like road traffic accidents, and then COVID-19 was 0.8. This data was gotten from 2021, so that was right post-COVID. The United States, on the other hand, you see the big difference. There's a shift. So here you do not see anything like malaria, diarrhea. You're talking about cardiac illnesses, so ischemic heart disease, stroke, dementia, Alzheimer's, things that come due to age, because you have a longer lifespan in that side of the country than here in Nigeria. Drug use disorders down the list, and some colon cancers. So 77% are non-communicable diseases, and 16% are communicable disease. And then injuries tend to be similar because anyone can have a road traffic accident and things like that. These are accidents and incidents that just come from behaviors. And Nigeria at a glance, population in Nigeria is about 227.8 million. The income per capita is very low. It's $833. Life expectancy has improved. It is now 64 for females and 62 for males. And infant mortality has improved somewhat too, which is 60 now per 1,000 life births. Unlike the United States at the glance, population of 343.4 million, and per capita income, it's $73,207. So imagine that, 835 to that. And life expectancy for females is 79 and males 73, and infant mortality less than 6 per 1,000 life births. I love this picture. So in 2003, The Economist this was the front page of that, the shape of things to come. So this was just showing the change in the shift of human lifestyle that was causing more diseases, leading to more chronic diseases and metabolic syndrome, as we call it. So I want you to have this picture in mind and think of the shape of you. In 2003, what were you like? So you can see the man here starting from slim, erect, and now having a central adiposity, having a big abdomen in front, the tummy is big with the hump at the back, still taking his bottle of Coke and drinking with no problem. Keep that. What is the shape of you presently? And think about what you were in 2003. That leads me to know your numbers. Know your numbers. These are my cliche things that I use to always talk to people about being healthy. So what numbers are important? Your blood pressure. The perfect scores are 120/80. Your cholesterol, total cholesterol in the body, you want it less than 200 milligrams per deciliter. Blood sugar, we don't want you having diabetes. That's why we're checking the blood sugar. Is it less than 100 milligrams per deciliter? Your body mass index. So is this normal? This takes your height and weight and just puts you in a range, in a scale range. Are you between 18.5 to 25? Are you overweight or obese? And what's your waistline? Do you find that your tummy is looking bigger than it was? And we want the perfect score, less than 35 inches for women, and for men, 40 inches. Do you know your numbers? Think about it. Have you ever even wondered what your numbers are? Have you been to a doctor's office and checked yourself once and they said, oh, your blood pressure is okay. Oh, this looks high. Oh, have you ran a blood test before to know what your cholesterol numbers are looking like? Have you checked your weight and height at any point in time? Do you know what your waistline is like? What's it measuring? Blood pressure. I mentioned the perfect score is 120/80. It's elevated when it's between 120 to 129 or less than 80. Hypertension stage 1 to 130, 130 to 139, 80 to 89, stage 1 and stage 2, 140 or higher, and 90 or higher. And then the crisis where someone just walks into your office and says, I have a banging headache, and you check the blood pressure and it's almost like 200 over 120. It's high, and you were screaming, oh my God, you're like walking dead. So hypertension, it's a great high risk for stroke, and also heart diseases, a heart attack, and also kidney failures. That's why we want you to have normal blood pressures. Have you ever checked your blood pressure? You don't have to answer me loud. You can just write in the chat, yes, no. What did the numbers look like? Did they say it was high? Did they say it was low? Just put in there and I'll have a look at what people are saying. Cholesterol, have you ever had a blood test, a lipid panel test done before? What did the doctor say? Was it much, normal, good? Did they tell you bad cholesterol was high or good? So imagine your blood vessels are like a pipe, and blood is like water running through the pipe, and it's just flowing and going around your whole body and doing what it needs to get done every time to make you function properly. So cholesterol builds up in the walls. You can see in the picture in the lower right corner. The higher cholesterol you have in your body, the cholesterol just keeps sticking to the walls of the blood vessels and sticks and sticks and sticks. And sometimes it can break off and go somewhere it's not supposed to. And sometimes it doesn't. And your body keeps fighting to, take the blood around your body with a small lumen. So imagine a pipe, I said, water is rushing through. If you have a clog somewhere, you can imagine the force trying to pass around the clog to get water to where it needs to go. That's the same thing that happens in the body. And sometimes the clog can go off, and of course, the pipe can blow off too, because one or two things: the pressure is too much, that leads you back to the blood pressure going high, or the vessel, so the pipe can take the clog and it decides to just disintegrate, and then it loses its elasticity and breaks off. So that's what cholesterol does. The higher cholesterol you have in your body, it builds up and it starts sticking in the walls of your body and the walls of your arteries, to be exact. Worst case, around the heart, higher risk than around your body, around the other parts of your body. It blocks the flow, and it causes stroke or heart disease at the end of the day. The number of cholesterol you want, the total cholesterol in the body, you want it less than 200. So that's the ideal number, 200. LDL, which is, we call it the bad cholesterol, we want it under 100, and HDL above 60. So that's a good cholesterol, which is said to be protective. Fasting blood sugar, so your sugar. Here we're trying to prevent diabetes. Have you ever checked your blood sugar before? Is it high? Is it low? Do you have diabetes? Is there a family history of diabetes in your family? Or are you diabetic yourself? If you are, do you actually have good control of your sugar levels? Do you know what your fasting sugars are like? When you eat certain foods, does it make your blood sugar rise so high, or is it normal? Are you aware of these things, or clueless? Another test we run, apart from just checking the fasting sugar or your random blood sugar, is the hemoglobin A1C. And when we do a check for that and it's above 6.5, we diagnose people with diabetes there. If it's in between, you say we're pre-diabetic, we run the test again, various things happens, and then of course it's low. If it's lower than 5.7, it's normal. And body mass index. So this is where your height and weight comes into play. It's a good screening tool. So I myself now, I checked, so I just had a baby last year. So I was like, oh my God, I'm overweight, I'm fat. I feel like I need to start losing weight. So my BMI was about 26 at that point, so overweight. And I've been working on myself, losing weight. I want to get back to my pre-pregnancy weight, where I was more with a BMI of 23 and I was more comfortable. So there, this to calculate this, if you know your weight in kilograms, you take that weight and your height in meters, you square that and you divide it. What's the number you're getting? If it's between 18.5 to 24.9, normal. If it's between 25 to 29.9, you're overweight. And if it's above 30, we say obesity, and obesity has various grades till morbid obesity over 50. And so I think this is a better picture that kind of shows the increase in weight in a person. So we want to be where the green man is, standing normal, 18.5 to 24.9. And we don't want to be going towards the right side. If you find yourself at, of course, overweight, there are various things you can work on and do to get you back to normal. If it's obese, there are various things too you can do at various levels, or medications you can take also, and that would take you between the normal body mass index. Last but not the least is your waist size. What is your waist size in inches? Take a tape rule and just measure your belly. And so we always say the more fat the people that have central adiposity, so more fat towards their tummy area, are at higher risk for hypertension, obesity, diabetes, all the chronic diseases that we do not want to have. So are you apple shaped or pear shaped? Um, so that's a homework for everybody. Measure your abdominal circumference. What do you find you're measuring? Are you less than 35 for a female, or are you less than 40 inches for a male? These numbers are important, which I've instigated once or twice, because the higher they get, they can lead to certain diseases. Hypertension, stroke, cardiac failure, diabetes for the glucose levels, obesity. These can then lead to various disability, mobility problems, and we do not want to be there because, or if we have one or two of these diseases, are your numbers controlled? That would be the other thing. Do you know your number, and are your numbers controlled? If your numbers are controlled, good for you, because that means that you're working on yourself, you're doing the lifestyle changes where you're taking your medications, you're doing everything together. And that reduces your risk for, more disability because of the certain problems or diseases you currently have. And at the end, you feel more well and are more productive at your workplace and in your relationships and everything that you do. What can you do every day to help yourself be closer to the perfect numbers? First, increase physical activity, keep moving. Set a timer every 30 minutes, get up from your desk. I have a standing desk at my office. I do not sit at work. I walk around, I stand, so I only sit when I get home. And I did that purposefully because I had them take the desk away, because I noticed when I started sitting down to do things, I would not get up. I would be at my desk, I would have lunch there, I would do everything because I had so much work to do. So I'm like, nope, that is not helping me because I'm not moving. Take the desk out. I keep moving, stand, walk when I go see patients, walk, have 30 minutes during my lunch break, come back, then continue my daily activity. What am I eating? You're advised in your plate of food, it's best that you eat more plant-based foods, more plant fats. So fruits, vegetables, protein, and moderate amount of carbohydrates in your plate. These are healthier for you. These do not clog your arteries at the end of the day, and these keep you healthier. Sleep well. Are you sleeping at all? How much sleep do you get daily? You should get about 7 to 9 hours of sleep. I always say shoot for 8 hours if you can. And it doesn't count if you have bad sleep during the week and then you make up for it over the weekend. No, does not count. You want to have good sleep every day. That's what improves your health. That's what keeps you less stressed. That's what allows all your hormonal levels balance in the body. Daily rest, not intermittent rest. Rest well today, tomorrow not, and then you think the weekend you can sleep all day and it would reset. It doesn't work so much for the body. Your relationships, love people, maintain and form healthy relationships, try and take away toxic relationships that are not positive or building you up or helping you emotionally, and stay less stressed. You don't want that. Stay calm as a person. What do you do to manage stress? Do you take walks? Do you just need to sleep? Do you just need to listen to music or read a book? What Anything that works best for you, and you notice that you feel calm, rested, and relaxed, you should put that in your daily routine. Avoid risky behaviors, smoking, alcohol, um, these things. I don't want to dive too much into them, but the presence of those two can affect you negatively in your health. And just be present in every day and everything that you do, and enjoy being you. Thank you very much. I'll take your questions. I hope I was not over time.
Thank you so much, Dr. Hawa Balami. This was amazing. I was taking notes while you were talking, and I love the graphics that you use throughout. So we'll open it up to Q&A now. Thank you, Uju. Uju's clapping. So we'll take questions. I will prefer if you raise your hands, and then I will call on you and then have you unmute. So whoever wants to go first. So I have a question while waiting for others to respond. And this question is for you, Dr. Balami, and Dr. Korea on the line as well. But I noticed from your numbers, Hawa, that women seem to live longer than men. Is there a reason why?
From various studies, people say it's because of relationships. Women tend to have higher social circles. Also, women have healthier seeking behaviors. So a man can have a 3 days, 1 week. A woman will have a headache, and the second day she would go seek doctor's opinion about it. So they present her.
Thank you. Dr. Korea, did you want to add something?
Yeah, I think it's a very complex question, but I'll provide some insight. Can you hear me well?
Yes.
Okay. So I think that, like I said, it's a very complex question, and there are just a lot of angles you can approach it from. One, obviously, is for the most part, I'm not discounting that a lot of females who are breadwinners, but there are a lot of males who are breadwinners. The stress of life, obviously, is largely on theirs. And Dr. Balami made it clear that stress is a big factor. And so the men invariably may be bearing most of the stress. I'm just answering the question directly. And then from a hormonal perspective, just like she mentioned, the higher your HDL, the good cholesterol, the more your heart is protected. And we know that estrogen, which is a female hormone, actually makes your HDL higher, which is why women wonder postmenopausal when they start losing that estrogen benefit. And Uju can attest to this. Their risk towards cardiovascular disease obviously goes up, unlike when they're premenopausal, when they have a lot more estrogen, And testosterone, which is the male hormone, actually lowers your HDL, and your HDL protects you. So I think that could be part of the reason as well, So let's see what the professor of gynecology can say on that.
Before we invite Uju,
Okay.
Dr. Korea, can you just say a little bit about your background?
Oh, okay. Sorry. So I'm a physician based in Fairfax, Virginia. I went to medical school in Nigeria last century, so I'm an old man. And came to the US 1988. And since then, I did my residency in the US. I studied internal medicine, subsequently did critical care medicine. And over the past 30 years, practiced both as a critical care doctor and urgent care doctor and primary care doctor as well. Thank you.
Great. Thank you. Would you, did you want to add something about the hormone side of things? And if you could introduce yourself, I think I need to unmute you. Sorry, just give me 1 second. Can you speak? Oh, let me see. Can you unmute yourself, Sandra, or do I still need to? Okay, this isn't working.
I think so. We can talk.
Okay, we're having technical issues, unfortunately. Okay. I don't know why it worked for Dr. Courier, but it's not working for Dr. Laveau. Okay, so we'll just move on to the next question. Are there any questions so far? I can't really see the chat room.
Oh, let's see.
Okay, so the next.
I can see it.
Okay,
I can see the chat room.
Okay, is there any question in there that?
Okay, just before I answer that, Uju said she can't talk, so she might be tied up. That's why she's not responding.
Yeah, no, something is the app. It's not letting me unmute her.
I see. Okay. But she says, sorry, I can't talk. So it's
Oh,
almost
okay,
like,
got it.
yeah.
Got it. Okay, got it.
So
okay.
were you asking me about any
Are there
questions on
questions
the
in the chat room? Yes.
Yeah, I see a couple of them. Do you want me to read them out to you?
Please, just one at a time.
Sure. So this one came from Dr. Madueke Lavo. She said, what is your take on the fact that BMI is standardized based on the non-Hispanic white male? How does it impact those of different racial groups? Does it?
Hawa?
Okay. Yes. So that's why in that instance, as a physician, you should also look at the other things. So the body fat percentages, the fat distribution of the person actually in front of you. So the waist circumference, their muscle mass, bone density, all that comes into play. Because as we know, it's just a guiding tool. It's not a diagnostic tool. It's a guiding screening tool that we use. So you don't use it to diagnose completely. And so when I have a patient, especially because I'm in Nigeria and we know that our body fat percentages and distribution are very different. People are more endowed, so generally some people are bigger in one aspect or the other, and that can put them overweight or even obese. And when you check the fat distribution or their waist circumference, they're normal. So you use the tools you have.
So the second question is from Adugo Ezi. She said, thank you, Dr. Balami. Could you give your opinion on the changes in the food pyramid? Yes.
Food. Okay, so I'm not a dietitian, but food pyramid changes. Over the years, the shift, to be honest, has not changed fully from we knowing that the healthier things are plant proteins, plant fats, lots of water, and lean protein. The carbohydrate measurements, distribution, how much you should take, how much you should not, I would say, depending on your state of health, so diabetic or not, family history, pre-diabetes, whatever the case may be, that should determine how much carbohydrates you eat in your diet. So whenever you take a plate, just make sure half of that plate screams healthy plants.
Okay, thank you. I think, Dr. Courier, thank you so much. I was able to finally get. Oh, sorry, go ahead.
Okay. I wanted to add something. Dr. Balabida was quite an excellent delivery, and straight to the point, easy to digest. The only thing I wanted to mention, I don't know if you did mention that, because at the point I stepped out. There is also a number, it's called the calcium score. I don't know if that, was that mentioned?
No, I didn't put that, no.
Okay, so that should be something that should also be included. What's called the calcium score. It was quite, I guess it was experimental or researched 20 years ago, 15 years ago, but recently it's come full circle mainstream.
Yeah.
It's really just as important as your cholesterol. Some people actually believe it's probably more important than the cholesterol. And I don't know if you want me to go ahead and talk a little about it.
Yeah,
Or do you wanna...
do talk,
do.
do.
Okay. So basically, not knowing whether all the people here are in the medical field or not, so I'll try to make it as basic as possible so that we'll all understand it. Just like you rightly said, the cholesterol, when it is being ferried in the bloodstream, can induce damage on the blood vessels. What we now know is that as it induces that damage, the blood vessel tries to heal. Just like when you have a wound on your skin, your wound tries to heal. And if you know what keloid is, that would be the best analogy I will use to describe what I'm going to say now. So imagine a keloid is an excess wound scar on your skin. That's basically what this keloid is. So imagine a situation where this damage to the blood vessels is leading to what looks like a keloid, so to say, on the inside of the blood vessel. And within this damaged area, the body tries to deposit calcium on it. So the thinking is that the more calcium you have there, it's a measure of how much damage has happened to the blood vessel. And that means how much effective diameter of that blood vessel can allow blood to flow. Again, use the keloid example as a kind of an analogy. So that means if you're able to quantify how much calcium is on that damaged area of the blood vessel, it gives you an idea of your risk of having a heart attack. So it's very important for those who are at least 40 years old. This calcium score is most relevant between the age of 40 to 75. When you go to your doctor, particularly if you have a strong family history of heart attack or strokes, ask for your calcium score. And it's very cheap, at least for those overseas. It's only about $80 to $100. If your insurance is not going to cover for it, just get it. Get your I can't emphasize that enough. Get your calcium score.
Can you type it into the chat room how to spell it?
How to do what?
Spell it.
Oh, okay. Let me write that down. Calcium score. Calcium.
Oh, calcium score, like calcium, like the element.
The element, exactly.
Okay.
Yeah, calcium score.
I was hearing cashew for some reason.
Oh,
okay.
Sorry. So calcium score, exactly.
Okay.
So 0 means your risk of heart attack is very low. And then there are different levels, 0 to 100, 101 to 2. They're just a level. The higher the number, the higher your risk of heart attack. The advantage of it is sometimes, people are told their cholesterol numbers and they're reluctant to take medicine because of all the things they hear about medicines. If you have a high calcium score, then it's a lot easier to convince the patient. So, okay, listen, your calcium score is high, your cholesterol is high, please start doing XYZ. Be very aggressive in all the things Dr. Balami talked about. Or even if you start taking your cholesterol medicine. But if your cholesterol is high, but your calcium score is 0, then nature is protecting you. See, if you want to delay when you start your cholesterol medicine, doctors are not going to push too hard on that. So I think that's kind of the relevance of the calcium score. One, it helps the doctor have one more information to quantify your risk of getting a heart attack. And it also allows both the patient and the doctor to make decision about how aggressive to be on preventive strategies. I don't know if that makes sense around to everybody.
Yes, thank you so much, Dr. Kure. Let me ask one more question to Hawa. And so a lot of people are using GLP-1 lately. What exactly is it doing to the body? And are you seeing many cases of it in Nigeria? So like here, some insurance will cover it. So I wonder if there's a higher, like a, higher prevalence here than in Nigeria.
So yeah, we're seeing it here too. And here people are taking it even though they are not obese or they don't meet the criteria for the medication. At least in the US, there's a standard. So the insurance will not cover it unless you are classified with a BMI above 30. Sometimes you have to have prediabetes and other things, depending on the kind of insurance you have before they would actually allow or pay for the medication. So yes, we do see it. People take it. Some people take it without medical advice and just because they want to lose weight. And but the thing is, like every medication, you also have to do the work. So I've seen scenarios. I've seen people on GLP-1s for about 2 years, 3 years. Two close family members, and I've used them for research too, whereby there were a few months you travel to certain countries, and because it's a cold carriage, you don't want to carry it about, you decide to just leave it till you're back in the States and then you take it. You notice because either your eating habits change, you start creeping 1 or 2 pounds here and there. And so there it goes back to lifestyle. You cannot kick the lifestyle out and just keep using a GLP-1 the whole time. That means you would use the GLP-1 for life.
Thank you. Dr. Curry, did you want to add anything I know how I mentioned it for Nigeria and the US. I think that was very direct answer. Is there anything else you wanted to add or?
On the GLP-1 agonist, you said?
Yes. Do you see a lot of people using it? What is it doing to the body? Like it just seems like magic. You're taking this medication and then it's just somehow chopping fat away. Like what exactly is it doing?
So
Just a couple of minutes.
What did you say?
I said just a couple of minutes, just because we're running.
Go ahead. Okay. So your GLP-1 obviously starts glucagon-like peptide 1. Okay, it's usually produced in the intestine. So when we say GLP-1 agonist, it's basically a medicine that acts like it, and it does a number of things to the body. Number one, it is thought to tell the brain to make you to stop eating. That's one thing. So it reduces appetite. It also slows how quickly the food in your stomach is pushed downward towards your intestine, and then it suppresses a hormone we call glucagon, and by doing that, it reduces the amount of sugar that your liver pushes into the bloodstream. And finally, some people believe that it also stimulates insulin release. By stimulating insulin release, insulin drives glucose away from the bloodstream into the cells. So all this together will lower your blood sugar. As regards usage, you have it both in injection and tablets. But one thing I also should mention is, like what I was told in medical school, every medicine the doctor gives you is poison in small doses. So there are risks with GLP-1 agonists. So it's not some, I know people take it like candy now, but there are risks, and you really got to make sure you discuss those risks with your doctor. And finally, there are absolute or relative to absolute contraindication why you shouldn't take it. If there's a family history, a personal history of what you call neuroendocrine cancers, there are some cancers that if it exists in your family or you've had it, you should not take GLP-1 agonist because you increase your risk of that cancer. If there's a family history or personal history of pancreatitis, you have to be very careful with GLP-1 agonists. So it's a great drug. It's played a lot of role in medicine today, but it also has some problems that you should always discuss with your doctor. Thank you.
Thank you, Dr. Hawa Balami. Thank you so much, Dr. Charles Okorie. Hawa, that was just an amazing presentation. And I'm sure it's getting a lot of us to really, really think about our numbers. Especially, I think most people get their physicals done this first quarter. I'm yet to get mine done. And so now I know kind of what to pay attention to when I get it done. So thank you so much. You can reach Dr. Balami at Daniwa, I'll put in the chat room, DANEEWAH. I think that's correct. Daniwa. Or at GGAC_NG. And if you want to work on do any professional development, whether in Africa or here in the US, go to aprofessionalafrica.com or reach out to me directly and I will let you know what to do from there. So thank you so much, everyone, for your time. And I'll talk to you outside of this later on. So have a lovely month. Bye-bye.
Thank you.